So the research that we did looked at the symptoms across childhood dementias, and we were able to show that amongst children with many different dementia disorders, that it really went beyond just cognition, learning, thinking, memory, communication. The impacts were very marked in terms of behavioural difficulties, sleeping difficulties, movement, and also eating.
It's also important to recognise that in many of the childhood dementias, there is also involvement of organ systems outside of the brain and nervous system. And so that might include liver and kidney disease, pulmonary disease.
Overall, there tends to be a period of sort of the early symptoms initially emerging, and then a period of often more sort of rapid loss of skills. And then there is often, again, a longer period of sort of what we call end-stage disease, where the child might be not able to do very much and be very reliant on a lot of extra help and support. They might have difficulty with feeding, and so that can sometimes mean that they need a feeding tube or a peg. They can have ongoing difficulty with seizures, and that needs anti-seizure medications. They can have difficulty in terms of contractures, difficulty standing, difficulty with transfers.
And so some children with childhood dementias demonstrate very rapid loss of skills and sadly a very premature death in early childhood. But some children will progress slowly and not present until their teenage years when they're at school and struggling at school. Children demonstrate a progressive neurological loss of function and a premature death across the spectrum of these diseases.